Lindsay, thank you so much for coming back again after that fascinating interview about the situation in Canada.
No problem.
So your day job is a pharmacist, and you have the friendly. I always forget friendly pharmacy 5. That's it.
Yes. Yes.
Yeah, and you do 5-minute videos, unlike others that could be mentioned. So
it's not easy. It's not easy.
Yeah. So I do know you are vaccinating. You've been vaccinating the past few weeks. What vaccines have you been giving?
Yeah, we've had a few different vaccines available in Canada this year. And so we've been giving, I actually kept the boxes of a few of them. So one of them is called Fluviral. I don't have that box, which is a trivalent vaccine. The other one, I actually have the ones that we were giving seniors in boxes. So one is called Fluad. So this is an adjuvanted vaccine. So when they put an adjuvant in a vaccine, it's supposed to help stimulate the immune system and provide a little bit more of an effective response.
You know, I've never really understood that. So you're giving the normal antigen.
Yes.
And then you like sprinkle some magic powder in that makes it work better, called an adjuvant.
Yeah. So the data,
tell me.
So to be quite honest, the data that we've had from Health Canada has, in the last few years, has shown that actually the Fluad has been equally as effective. It's not been shown to be more beneficial, and it does come with the risk of more adverse effects. However, this is one of the vaccines that we had available this year, and some people did still opt for it. It was pretty well tolerated. The side effects did not seem to be much of an issue. Most people that I vaccinated and followed up with on this one said that they did not find it any different than previous years. Is it more effective? I mean, for this year, we won't know, right? But I mean, the adjuvant in theory could help to, improve the immune response. Yeah. But really, I think it can just sometimes causes more side effects. So that's
I think kind of started in the elderly, didn't it, where they were getting very poor responses.
That's right.
To ordinary influenza vaccine. So they put the adjuvant in, and that seemed to improve it in some cases. But quite what the immunological rationale for that was is a bit strange. But it does seem to stimulate the immune system to respond to the antigen in a meaningful way.
That's right. And then the other one that we had was the and I just covered this little part up because we had written over it. This is what happens in pharmacy. We sabotage all of our packages. So this is the Fluzone high dose. Okay, so this is actually 4 times the concentration of antigen, and this was for people over the age of 65 as well. Okay. So, but the same side effect profile. So we didn't see any worse side effects with that. The issue with the Fluzone high dose was that it was prioritized for long-term care and hospitals here. So pharmacies and public health got a very limited supply, and it wasn't covered in the majority of provinces here in Canada. So it was about $80 for that. That one went very quickly. And then we also had a preservative-free version called AgriFlu. And that's what the majority of Canadians got if you were under 65. So
what sort of efficacy have these flu vaccines got, Lindsay? I mean, are they 60% or are they less than that?
Every year it's different, and the flu vaccine efficacy can range anywhere from, say, 45% to 60%. And they try to guess every year based on previous years and based on what's been circulating as to what the most effective combination would be and what is more likely to be circulating. So it's very hit and miss. But we're hearing a lot about efficacy of vaccines lately, and we're hearing about high efficacies, with these mRNA vaccines, even 94%. That's very unusual for a vaccine, and I think that people need to understand that that's not something that we expect or that we have to have. I think Anthony Fauci was saying even a vaccine of about 70% would be good. And, we see that, with the flu vaccine ranging from, say, 45 to 65 year to year, that is still significant. And it's still, even in the people who still get the flu after, in the years that they have gotten the vaccine, the flu is usually milder. It's usually a much milder case. And anyone who has had actual flu knows that the actual flu is quite severe. and you will remember that you've had it. Lots of people get confused with a cold and a flu. If you've had actual flu, you are in your bed, you cannot move, you are, you know, you almost feel like you're near death. And so that's not to be confused with, with the cold. I just wanted to make that distinction.
Oh, I mean, the last time I had proper flu, it was actually 1991, I think it was.
Mm-hmm.
And I remember lying there thinking, well, if I die now, this is fine. You know,
Yes.
I felt so indescribably bad.
And that is
unbelievable how bad I felt.
Yes, I've had it too. I've had it too. I could not walk from one room to another.
No. In fact, I was downstairs once. I tried to get into bed and I didn't make it. I was lying on the bedroom floor for about an hour. Yeah. You know, it was unbelievable. But other years when I've had the flu, so a couple of years ago I had the flu vaccine, and then of course at work I worked on A&E at the time, exposed to flu all the time. I think I probably got it and just had an attenuated version because of the vaccine. Does that make sense to you, that you can get a much milder form?
Yes, definitely. And had you not had the vaccine, you could have had a much more severe outcome that year.
Yeah, absolutely. Yeah. So how do you see the COVID vaccine shaping up in Canada? Is there are you hoping to be giving COVID vaccines soon?
I'm sure that I will be giving COVID vaccines. And I think generally across Canada, the uptake is looking at about maybe 60 or 70% of Canadians say that they will get the vaccine. Some might be more hesitant than others. This is a heated topic right now in Canada because we all want to know when these vaccines will be actually rolling out into the arms of Canadians. And our federal government is being quite tight-lipped on that at the moment. And part of the issue is production capacity in Canada is quite limited. And also these mRNA vaccines, you can't just produce them, you know, just anywhere, right? So we haven't been given dates. It's sounding like early 2021. And whether that means January or March, we are still waiting to find out. And I am a little bit concerned because even the distribution of flu vaccine this year, it was a record-breaking year for demand, and distribution was quite complicated, to be polite. So, you know, they say that they are getting things in order, and I want to be optimistic. Don't be polite for me, Lindsay. You can be as rude as you want. Well, and really, when this will actually get into the general population, we know it's going to go to long-term care and frontline health workers first. Yeah. And also what the definition of a frontline healthcare worker is, like, I don't know if that means pharmacists or not. You know, so until it gets into the general population, you know, it might not be till, you know, maybe in the summer or the fall, depending on how things go.
I think it just reinforces the fact that we're not quite there yet, and we've got to carry on with the other measures for the time being. I think that's such an important point. I think it will also depend how the Oxford AstraZeneca vaccine goes, because that can be made. That is being sort of divided out. There's about 20 manufacturing partners around the world on that at the moment.
Yes.
I'm optimistic about it. I think that's the vaccine most of the world is going to end up with, because it costs about a tenth of the other ones.
Yeah.
The Pfizer and the Moderna vaccine especially is really quite expensive. So
yeah, well, and the storage requirements are complex as well. So the
Pfizer especially,
yeah. AstraZeneca is looking good. We need a little bit more safety data on that, a little bit more, a few more clarifications, right? But yeah, I agree. The AstraZeneca one is one that's looking to be much more accessible for sure.
Yeah. So basically, slightly disappointing there for Canada, really. Probably rolling out slightly later than the UK and the US.
Yeah, I think Canadians might be seeing other people get vaccinated. We might have a little bit of vaccine envy because it does not sound like it's coming here before the end of 2020. But the government's being very reassuring that it will be coming in early 2021. And so we just need to hang tight until then.
Yeah. You mentioned that only about 70% of the population, which I think is roughly the figure for Canada, are prepared to accept the vaccine now. Once people start getting vaccinated and other people see that they're not getting bad side effects, that they're not getting COVID, that they are allowed to take particular airline flights, that they are allowed to carry out particular occupational duties, I strongly suspect that the voluntary uptake will increase quite dramatically after that. Definitely. I mean, I would imagine by this time next year, 90% of Canadians are going to be vaccinated against COVID-19.
Well, that would be great. I'm hopeful for that. I do think that as time goes on, people will see this is safe. Yeah. I mean, they're going to see all the healthcare workers getting it. That's got to mean something, right?
Absolutely.
If doctors are lining up for it and they're able to continue their duties, then that's very positive.
Yeah, and it'll be a requirement for some travel and some employment, so that there'll be.
Yes.
Yeah. So, do you think that this virus is going to go away altogether? Or do you think it might be left somewhat endemic?
Well, I think I'm concerned about, the mutations of this virus, and also, the fact that we don't know about the longevity of this vaccine, right? So how long is it going to be effective for? Are we going to need kind of an annual COVID vaccine? I know that you have said that it will be possible to completely wipe this coronavirus off the face of the globe. I'm not sure if that's still your opinion. I would love that. But I think it's going to take time. Like, that's not happening next year.
Yeah,
right?
I think it's going to take a few seasons.
Yeah. It's definitely possible, but it's going to take a few years, I think. We'll have to see how it evolves over time.
Yeah, and of course the thing about Canada is Canada had SARS in 2003, didn't you? We didn't really have it in the UK.
Oh, you didn't? Yeah.
No.
Yes.
No, it was mostly the China, Hong Kong, North Korea, Taiwan area, and Canada was kind of the Western exception. So and that no longer exists, and I find that reassuring.
It's encouraging.
That would no longer exist. Yeah.
Encouraging.
Yeah. Right. So then. List that I've been waiting to ask a pharmacist about, Lindsay, is PPIs. Now, PPI stands for proton pump inhibitor.
Correct.
And basically what that means is that it stops the stomach producing as much hydrochloric acid. That's, my knowledge doesn't go too much beyond that. Do you want to tell us a bit more about PPIs?
Yeah, so proton pump inhibitors have been around for a good, I think, 10 to 15 years. And, there's a pump in your stomach that is stimulated by hydrogen and potassium ions, and there's a bit of an exchange there. And when the stomach is stimulated by, eating or even seeing food, this pump starts to throw acid into the stomach.
This is the hydrochloric acid.
This is the hydrochloric acid.
Yeah.
And sometimes different health conditions, sometimes even stress, or the overuse of anti-inflammatories such as ibuprofen, naproxen, diclofenac, can
even aspirin will do it, won't it?
Aspirin can do it as well. Can cause the stomach to be more prone to an overproduction of acid, and this starts to eat away at the mucosal lining of the stomach and can leave you prone to say ulcers. So proton pump inhibitors were a great scientific innovation as far as treatment for peptic ulcers are concerned. But, we have seen these become, prescribing for this has become more and more common for even just a bit of stomach upset or some stomach pain, or even just like for the treatment of a peptic ulcer. But we sometimes don't see proper follow-up. So if your peptic ulcer has resolved in 8 to 12 weeks, you don't necessarily have to be on as high of a dose or even necessarily on a proton pump inhibitor, depending on your medical condition. So what I see in pharmacy practice is that a lot of people are being prescribed proton pump inhibitors for months and months and months at a time, and without adequate follow-up. And when your stomach is not producing the right amount of acid, these proton pump inhibitors are very effective at reducing the amount of hydrochloric acid that the stomach produces.
It goes down to almost nothing, doesn't it?
It's very, very minimal. They work great. And if you've ever had an ulcer, you probably, are a fan of this medication. However, over time, you do need that hydrochloric acid in your stomach to break down your food. And we know that proton pump inhibitors, especially when they're used for a period of more than, say, around 8 weeks, can leave you more prone to intestinal infection. And there is some evidence, and I have that up on my channel, showing that it can leave you more prone to even respiratory infections like SARS-CoV-1, SARS-CoV-2.
That's surprising, isn't it? Yeah. I mean, you can understand the gastrointestinal infections, obviously, Because when you eat the bugs, the hydrochloric acid dissolves them, or when you eat the viruses, the hydrochloric acid dissolves them. But what you're saying is there's actually empirical data that indicates that people are more prone to respiratory infections as well.
And we do see that the SARS-CoV-2 virus does affect the stomach. People do get terrible stomach pain, intestinal issues, diarrhea, that kind of thing. And often during the period in which they are prescribed or diagnosed with COVID-19, they are often prescribed a proton pump inhibitor. And I'm not saying that that's bad. It's not. I'm talking more about the chronic, long-term use of these medications without proper follow-up. And there are a few conditions like esophagitis, chronic peptic ulcers, where you do need to be on these long-term. But I see a lot of patients coming into the pharmacy and they've been on these for so long, they don't even know why they're taking them. And, you know, it's over-prescribing, and it's concerning. It's concerning because the acidity in your stomach is one of the ways that the body can protect itself from different pathogens. So thank you for bringing it up. It's something that it's kind of my vitamin D, the proton pump inhibitor issue, because I just see it. I see the overprescribing, you know, and it's quite a health concern for me. And I hear from other pharmacists, especially those in long-term care, that you know, we just don't see adequate follow-up as to, you know, sometimes patients are taking these twice a day, and really they could only be taking them once a day and be having the same effect. So
I see. Right. Okay. So that they're taking a higher dose than they need, and what we're saying is this can have an effect on people getting viral and bacterial infections. It could potentially increase their predisposition to even respiratory viruses.
Yeah, and I did go over a study on my channel that talks about that. So if anyone wants to see more information,
we'll certainly put links to that.
It's all up there.
Yeah, interesting. Yeah, good. Now, the next topic I've got, Lindsay, is, I think this comes from your Brazilian experience. The idea that mouthwashes, and I know I went to my dentist a few years ago, and she told me to start using a mouthwash, and I've been using one ever since. But there's some suggestion here that mouthwashes could actually protect against SARS coronavirus 2 and COVID disease.
Yeah, it's very curious. So this came up kind of across my desk yesterday. And, you know, I have heard over the last few months that there have been some studies about mouthwashes and their possible ability to inactivate the virus. And so, you know, that's been interesting. But this study I found particularly interesting because it's speaking about a mouthwash, and they've actually done an in vivo or in-person study. So most of the
in vivo,
most of the other studies have been in vitro. Yeah. And this study is coming out of Brazil, and actually some of the scientists are from a place. I used to live in Brazil for about 5 years. My husband's from Brazil, so that's where the link is there. It's coming out of with some from some scientists from the University of São Paulo. And they found this mouthwash in vitro to kill about 96% of, or not kill because the virus is not alive, right? But to inactivate.
I know what you mean.
To inactivate.
We could talk about that for the next few hours if you wanted to.
Yeah. To inactivate the virus.
In glass, in vitro, that's not too surprising because it can be very high doses of an antiseptic. It's a bit like cleaning a surface. But it's more surprising in life because when you use a mouthwash, it's going around the oral cavity, whereas the virus lives in the oropharynx at the back, and the nasopharynx. Now, if you got mouthwash in your nasopharynx, you would know about it, and you would not be very happy.
I know.
It would be a pretty. I mean, maybe people can remember a time when they vomited, and they get this horrible, strong feeling at the back of their nose because the vomit's gone up into the nasopharynx.
Yeah.
So clearly the mouthwash is not going in the oropharynx.
Yeah, and I think
not going in the nasopharynx, and yet this data is indicating what?
And what it's indicating is that it's capable of reducing the viral load in the mouth area. And in doing this, it's actually reducing symptoms, and in some cases, it's reducing the severity of disease. And so I thought this was very curious. And I'm going to look into it further. I'm actually interviewing one of the next week. So what they did is they did a randomized, they call it a triple blind, but it's, or double blind trial. They had 41 patients that were in hospital, PCR positive for COVID-19, and they tested their saliva, and their saliva was positive. Okay.
Yep.
And so what they did is over a period of about 96 hours, they gave them this mouthwash. And I think they had to gargle with it for about 1 minute, 5 times a day. Okay. And within 96 hours, the patients that were in, because they evaluated against a placebo. So the patients that were in the group that got the mouthwash, within 96 hours, they became negative. Their PCR was negative, and their symptoms improved dramatically. Out of the patients that did receive the mouthwash, their hospitalizations were about half the time of the people who did not, and their symptoms improved dramatically as far as their sore throat, mouth ulcers, and that kind of thing. The people who got the placebo, a third of them went on to be admitted to ICU, and half of those actually died. So it's showing remarkable efficacy,
it's fascinating, isn't it?
Not as a treatment, but I think that it's pretty clear that it is somehow reducing the viral load, and it's having an effect on the severity of disease. I think it's significant. That's why I'm going to interview one of the people from the study, because I would like to know more about it.
And we certainly would. This is so the people on the placebo trial, presumably they were rinsing their mouth out with plain water or something.
Yeah. I would assume that they were. Is
this some sort of special mouthwash, or is this the sort of mouthwash you can buy at any supermarket?
No, this is a special mouthwash, and it's called Phytalux, and it's based on a component called that they actually developed at the University of São Paulo. I'm just looking for the name here because it's like Phytalinina or something like that. I'm sorry, I don't have the actual.
No, that's okay. They put some chemical ingredient, some special ingredients into this that are antiviral.
Yeah, and it somehow reacts with the oxygen in the mouth and causes that oxygen to undergo a chemical reaction where it becomes reactive and inactivates the virus. So there's kind of
of course that makes perfect sense. It would form oxygen-free radicals because we have exactly the same problem inside cells, causing aging, causing cancer.
Yes.
Where you get free radical formation. That's why we take vitamin C and other antioxidants to mop up these free radicals.
That's right.
So that makes perfect sense. And the other thing, if you're reducing the viral load in the mouth, I guess that means you're reducing the whole body viral load. And one of the things that has come to light in this pandemic is that people that get low viral loads get less severe disease.
That's right.
So it's not ludicrous. I can kind of see the physiological rationale behind this. So I certainly look forward to listening to your interview, Lindsay. Going straight to the authors, of course, is brilliant.
Okay, I will. Yeah.
And any chance you could get the recipe?
Yeah, I don't know if I'll be getting that. It's so the product is called Dental Clean, and it's patented. So I actually had to pull some strings to even get the authorization for this interview. But so it's gonna cost about 30 reais in Brazil. So that's not too.
How much is that?
Not too expensive. That would probably be the equivalent to maybe about $6 or $7 here in Canada.
So the Brazilians could sell it to us, and we could buy it for a relatively reasonable cost.
Yeah, I think that it would be quite accessible. They've actually put in about $10 million to this into developing this product, and they did not know until COVID-19 hit. They started this study about 9 months ago. They did not know that it could be effective against COVID-19 until recently. So it's very encouraging. I think that every tool that we have in our toolbox is valid, and so these results are encouraging.
I mean, in the meantime, it wouldn't do you any harm to use ordinary antiseptic mouthwashes.
Yeah, and
my dentist probably do it anyway.
That's one of my questions. How is this better than a regular mouthwash? Yeah. And what if you trialed it against a regular mouthwash? Would it just be like placebo? I don't know.
And some people have been suggesting, I have no idea, dilute sodium bicarbonate mouthwashes. Does that make any sense to you at all? So soda bit. It's like baking soda, isn't it?
Yeah, it would taste terrible. I don't know how that would work. Maybe it could make the mouth more basic. That actually could do maybe the opposite, or I don't.
Right. Well, we're certainly not recommending or prescribing anything on this channel, but that's something we're going to look into. And certainly the regular mouthwash I've got tastes nice anyway. So, I use it every night before I go to bed anyway. But to use that several times during the day would be no great hardship.
No, it wouldn't.
Yeah, and I really like low tech interventions.
Yes.
So like remdesivir.
Yeah.
The World Health Organization have basically said don't bother.
It's done. Yeah.
But apart from anything else, it's high tech. You need an intravenous line, you need intravenous giving sets. You need to make sure you're not introducing any air, because you don't want air embolization. You've got to maintain your asepsis. Basically, you need to be a fairly skilled, registered nurse level person to give.
And that has to happen at hospital level or at a clinic.
Or by suitably trained personnel at home.
Yes.
I have trained people to do intravenous things at home. It can be done, but it requires quite a lot of training, and it's even a lot of nurses and doctors couldn't do that without specialized training. You need to. Whereas a mouthwash, it's so simple.
It's kind of like, it's not like vitamin D, but it's, sometimes we overlook the simple things. And so I think it's important to pay attention to these simple things that might make a big difference.
And would be very useful in poor areas, which of course is.
Yes.
I know it's something we're both interested in. Mm-hmm. So no recommendations on that yet. Stand by. More information coming.
Yes.
But fascinating possibility.
Mm-hmm.
Now, I know you're very interested in holistic care, Lindsay.
Mm-hmm.
So I think that the last thing we want to do on this video, because we don't want to overload people too much, although I could go on for ages, it's so interesting. I know you've been doing some work on mental health and mental health awareness lately. Could you just tell us your experience and what do you think about that?
Yeah, and I think that we are seeing that the population in Canada is definitely suffering from the psychological effects of this pandemic, and globally we are seeing this as well. And people who are needing antidepressants, anxiety medications, that kind of thing has definitely increased. And another concerning issue is that many people are not seeking the care that they need, maybe thinking that professionals are too busy, or maybe thinking that there's a stigma or that treatment is not available. And I appreciate you bringing this up the other day as well, because treatment is available. And often if you get treatment soon enough, you don't have to get to that moment of complete crisis where you cannot function day to day. And so, mental health is something that we need to be paying attention to during this pandemic. I mean, even for myself, it's been a lot of change and a lot of we've had to deal with a lot of different even anxieties or concerns over children or whatever it is, employment, anything like that, right? So it's a common concern. It's something that I think the more that we talk about it, the less stigma there is, and the more people are able to seek appropriate help and know that there is help.
I think it's a difficult time of year already, especially you get shorter days.
Yeah.
And I don't notice it myself, but a few of my friends have told me that I do get a degree of SAD, which of course is the seasonal affective disorder. The kind of winter blues. Yeah.
Yeah.
So we had the pandemic and the other stresses onto that, and it is a bit of a double whammy, really, I think.
Yeah, and when we're in winter over here in Canada, and so we get a lot less sunlight. We're not out and about as much. And even in speaking with people in the community this week, they just not knowing when the end is coming of this pandemic. So we don't have a date. We don't know, and not knowing that is hard on our psyches, I think.
Yeah. And also, I think the vitamin D can make a difference to mood as well. I think there's some studies that indicate that is a possibility, and of course that
I agree.
Time-related factor.
Seen some evidence of that. Yes.
Yeah, Lindsay, I do happen to know you've got a crib sheet there.
Yeah, I'm going to bring it out right now.
You're going to show us it.
this is not mine. Someone just posted this online, and I've posted it on my Facebook Friendly Pharmacy 5 page. But I just thought I'd share it here, just for your viewers today, because you know, mental health is important, and a lot of us are in isolation or not seeing the people that we always want to see.
Yeah.
These are just a few things that you could do every day: shower, take your medication, drink some water, clean something, tend to something that's growing. Be mindfully present to a song. All of these different things here, and a few little tips at the bottom.
Yeah.
So that's.
I think that's really helpful. And the other thing is just realize that struggling mentally is universal. It's entirely a matter of degree. And don't tough it out.
That's
You know, a lot of us are tough. We can tough it out, but we don't need to. Tell people treatments are available, and as well as that, you know, look at the people around you, and if you think they're having a tough time, just say, look, you're having a tough time just now.
That's right.
You give other people the opportunity to.
I think we can all be a little bit more vulnerable, reach out to our neighbors, people we wouldn't always necessarily reach out to, and just show that we care, or ask for help. You know, if people sometimes don't know you're suffering until you tell them. So there is help available.
Absolutely. And the help works, and tough guys and tough girls often aren't as tough as they look.
That's right.
They've all got squidgy inside organs, no matter how much they might like to pretend.
We are all only human.
Absolutely. Yeah. Lindsay, tremendous. We've gone slightly over the half an hour there, but I'm sure there's about 3 or 4 people still watching. So thank you again for those fascinating professional insights.
Thank you. Thank you for the opportunity.
Always preparation so easy when you know. When you're talking to someone who actually knows what they're talking about. That's great. So Friendly Pharmacy 5 is your channel. We'll put links to both.
Sure.
So much that pharmacists can do to improve the quality of life, prevent illness. You know, that's one of the things I like about your approach. You like to, you know, doctors, sickness doctors, not health doctors, you know. We need to be doing so much more to promote health.
Yes, and there's a lot we can do.
Just treat sickness.
Yeah, there's a lot we can do if we know how to advocate for ourselves in the healthcare system. And that's kind of the mission of my channel, is to teach you how to advocate for yourself and know the latest in healthcare, and get better healthcare and live a better lifestyle. That's the whole point of the channel. So
and that's what you communicate clearly, Lindsay. That's why we're doing this interview now, of course.
Thank you, Sean.
How many subscribers have you got now?
I have just over 900, I think. I just have over 900 right now. I'm trying to get over 1,000. That's kind of, you know, my goal, but I appreciate
that's going to be a minimum, right? So yeah, right. Subscribe to Lindsay's channel, please. Or,
thanks, John. Have a good.
We want a good. Let's say 2,000 by the end of the year. Is that realistic?
It could be. Anything's possible, John.
Let's go for that. So I encourage the YouTube community to do that. Great. Okay. So thanks, Lindsay. Great interview. You, fascinating stuff. I'm certainly going to watch that again, and I'm going to look into that mouthwash. I like the sound of that.
More to come on that. Take care.
And if it turns out to be bunk, we'll say that it's bunk. But
that's right.
So far, it's sounding interesting, cheap, and usable. So
that's right.
Keen to find more. Thanks, Lindsay. Great to talk to you as always.
Thanks, John.
Thanks. Bye.